Um, I would like to welcome Dr. Sandip Sharma, CEO of DecisivEdge Private Limited, with this presentation. Dr. Sandip, can you please unmute yourself? Yeah.
Am
Yeah,
I
sure.
audible?
Please begin with your presentation. Yes, sir, you are.
Sure.
Please go ahead.
Okay. All right. So, very good morning to all of you. I'm Sandip Sharma, representing DecisivEdge Technology, and we are happy to associate and partner with the summit at this time. We are a solution engineering and technology services company, and we focus primarily on healthcare and financial services. We have offices at Pune, India, Toronto, Canada, with headquarters at Newark, Delaware, USA. In healthcare segment, we have launched a product named Fifth Port in the US market, which is a patient engagement platform used for education and consent monitoring. In the COVID times, it is also getting traction from the huge number of clinical trials that are going on. In India, we have been working to help hospitals in their technology transformation journey and plan to launch ProMedic, a hospital information system framework, early next year. I feel Healthcare Transformation Summit is happening at a very crucial time when there is a need to examine not just healthcare, but almost every industry and come up with a transformation strategy. We have an opportunity to rebuild them better than before. Pandemic has had adverse revenue impacts in first half of this fiscal, but preventive healthcare cannot wait forever. And COVID-related treatment will remain another stream in near future. To overcome the challenges and take advantage of the opportunity at hand, hospital industry needs to unleash an overdose of digital era for next 2 to 4 years. As we are dealing with the decoding the digital era of health. So I really feel the time is here, and that is like next 2 to 4 years when hospitals have to really go in overdrive. So let me talk about some common challenges faced by hospital industry, core reasons behind them, and possible solutions as seen from an IT perspective. First and foremost, patient experience remains to be compromised. I think there are no two views on that. The whole process from filling a hard copy form to providing documents remains complex, which sometimes may entail visiting multiple counters, and those documents may not even make it to the central system. After initial formalities, an OPD patient would occupy the waiting area, oblivious to how he or she is placed in the queue. On the other hand, an IPD patient may be waiting to get a clear picture on availability of the desired room type. As footfalls increase, wait times keep going up for various reasons, including and not limited to doctor-patient ratio, scheduling, or simply managing the queue. Billing accuracy and promptness could also add to further wait time and presence of unwanted patients in an enclosed area, which is linked to patient safety again. With increasing consumerization of healthcare, patients look for offers and discounts and all sorts of things, and systems are not capable to handle the same, leading to manual interventions. Administrators must continuously monitor key attributes for efficient operations. In absence of forecasts, trends, utilization reports, decision making becomes more subjective. Beds may go unoccupied while there are patients waiting for one if the systems are not communicating dynamically. Essential drugs to regular consumables, everything needs to be stocked at appropriate levels to avoid blocking cash in unnecessary purchases. Financial reconciliation remains a big headache for the hospitals. With increasing penetration in healthcare insurance, majority of the revenue comes through the insurance cases. Claim settlement remains a lengthy process, stuck in submitting case papers in offline mode. When the consolidated payments are received finally by the hospital, there is added challenge to map them to individual patients. Doctors, as we know, are the backbone of the hospital, always short of time and engaged through variety of operating models, from permanent roles to contract roles to hourly models. These engagement models keep evolving on a continuous basis as per the need, but systems are not able to keep up with these flexible models, leading to counting errors. So let me move on to the next slide. Having talked about the challenges, let us look at some of the core reasons behind these challenges. So as we see, technology is one of the biggest reasons that is linked with lack of investment. Budgets are consumed primarily on regulatory compliance initiatives, medical equipment to meet expansion plans, thus leaving IT infra surviving on old technologies. It serves as a double-edged sword. On one side, the out-of-life technologies could pose risk to patient safety and entire IT operations, while on the other side, innovation and value-added initiatives cannot be executed in absence of desired baseline technology stack. While some hospitals seem to be performing well in isolation, they have limitations in sharing information across facilities within the same hospital network. This adds to patient problems while trying to get service from separate facilities and creates issues in consolidated reporting. M&A, as common these days, also becomes a trigger to interoperability issues, with merged systems having limitations in exchanging information across the entire organization. Some systems give an impression of being integrated, but actually, as you look closely, manual steps in between become integral part of that end-to-end process. The hospital contracts with numerous insurance providers and multiple third-party administrators present a complex scenario that could best be dealt with an automated process. Patient discharge process for insurance cases stretches for the need of formal approvals, which further impacts patient experience. Claim settlement period could run into months, causing delays in receivable collections. Hospitals have no choice but to have a dedicated team to handle outstanding insurance claims and coordinate through Excel sheets, emails, and phone calls. With this, I'll move to the last section of my session. And this may be high time to give a serious thought and design a customized transformation roadmap. Answer to these challenges lies in an integrated, configurable hospital information system that maintains a central patient registry. Patients could avail services from any facility in the network without having to share information again. Information is made accessible to all facilities for patient administration and billing in a seamless manner. A queue management system could ensure presence of only desired patients and keep them informed how long it might take for their turn. QR coding of medicine, consumables, and other material could make it easier in tracking inventories and timely replenishment without overstocking. Direct interface with TPA systems will allow desired patient information to flow automatically for submission to the TPA. With TPA in sync dynamically with the patient's diagnosis and treatment, final bill settlement happens quickly without delaying patient discharge. better receivable collection leads to improved cash flow for the hospital. Operation theater and costly medical equipment are not available in plenty, even for the biggest organizations. A scheduling system could ensure that doctors and staff can check the availability and book necessary resources and assets as per the procedure planned to be performed. A robust management information system could provide comprehensive reports with drill down ability to the executive management administrators. These dashboards will provide dynamic information about patient experience, operational and financial parameters, and enable informed decisions. Digitalization can truly shift the focus from dealing with volumes of data to delivering the value automatically. Just take an example. A patient planning for a procedure visits hospital to get the estimates. The estimate is arrived at using various predefined packages and multiple other factors. An AI ML driven model could be used here to compute more accurate estimate using historical data for the same procedure, same gender, same existing preconditions, and many more such parameters, which just overrides manually, looking through these packages. So as I come to sort of towards the end of my session, I would just like to highlight that DecisivEdge has been studying hospital operations and addressing these challenges for several years now. We realize that hospitals deserve a solution that can meet 100% of their needs and not just an off-the-shelf product. If you're dealing with any of these challenges and want to discuss your options, we are available. You can contact us. I thank you for your time and attention and enjoy the rest of the conference. Thank you so much.